edition of the Seven-Figure Dentist Playbook. I'm Dr. Tony Feck, and this is your source for all methods and manners by which you can make your dental practice more profitable. This episode is titled Back to School, Continuing Education in Dentistry. Let's get right to it. What are the benefits of continuing education? It seems like a very obvious question, and the answer may seem just as obvious, but let's review it anyway. This is how we grow. We are professionals, and the very definition of the word professional means that we are always learning more about our craft. We are always growing as a dentist, as a clinician, in our abilities to better take care of our patients. So there's obvious advantages to the care we provide for our patients, and that's our number one obligation. But we also grow personally. We expand our ability to deal successfully with the world, not just the world inside the four walls of the practice we go to work toward every day. And, specifically, something that's near and dear to my heart as the owner of Sunrise Dental Solutions, where it's about making more and keeping more and enjoying more and even giving more, then it just makes sense that the better equipped we are to succeed as a practice owner, the more we're going to receive personally in terms of abundance. Something else happens when we learn, and that is our mindset changes. We see things differently. How many times have you been to a course and you come back and everything that you were taught or exposed to at that course, it looks differently when you examine your patients? Then you almost have to ask for forgiveness to your patients, because all of a sudden they're saying, well, you never talked to me about this before, and what you want to say is, well, I didn't know, now I know. I mean, it changes our entire horizon. And if you're a dentist for any length of time, at least a couple of years, then you probably experienced something that happens to us all, and it's physical and mental and emotional burnout, where you just have this fatigue that impacts everything. You want to know how to energize yourself? You want to know how to get past burnout? Learn more. Okay, it really changes everything. Your thoughts change. And we can make the argument that of all the things that we invest in, and our resources, not just money, but time and effort as well, continuing education is the best investment that we can make. So now that we have made the argument why the benefits are well worth the price, let's talk about how you go about your continuing education. Well, the first thing you do is you make a plan. Now, anything of significance that you do in your life, not just your practice, it should start with a plan. You should evaluate, okay, what are we wanting to accomplish? Where do we want to go? What's that insight in mind? Another way of saying that, what is the vision? I'll even go one step further from vision and go to purpose. Vision is where we want to end up. Purpose is what should direct how we make that journey. I'm of the belief that we all have a purpose. Okay? We were all created for a purpose. Okay? Whether you believe in a creator or not, you can't deny that we've got DNA, and no one's DNA is identical to someone else's DNA. So if your DNA is different, then that means you have different likes, you have different gifts, you have different talents. And if you put all those things together, then that point at which everything lines up, and what we end up doing, we're happiest at, we're most successful at, that's our purpose. answer this question. Does doing this align with my purpose? Does doing this get me closer to my vision? Or does it make it far away? And it's a great way to make decisions. It's a great way to make plans. So with your continuing education, you ask yourself this question. Does spending the time and money and effort at learning this, does it line up with who I am, with what I want to do, with what my purpose is? And if it does, then that is a worthwhile thing for you to do. Now we just need to assess where you are. Okay, we've got 2 points now, and we need to create a straight line between those 2 points. And my father always taught me that the shortest distance between 2 points is a straight line. So we've got our vision, we know where we are, and now we need to create that roadmap. And it may be as simple as taking one course. It very likely won't be. It will very likely involve taking multiple courses, a continuum, possibly over an entire career. And each one of those courses should be a stepping stone, a goal, if you want, before you take the next one. And so this is the other part of the plan that's important. The steps in your plan for continuing education need to be in the right order. Okay? The order needs to make sense. You may want to skip to 10 steps ahead, but you won't be as effective because the 9 steps before that were meant to lead you to that so that you could get more from that. So we need to be honest with ourselves when it comes to our continuing education plan. Dr. Peter Dawson, one of my mentors, one of I think the greatest men in all of history of dentistry, he talked about this concept of consciousness. And he says, we all start at the same place, unconscious incompetence. We don't know what we don't know. Okay, I battle this all the time as a coach, okay? Because, there's something I've learned. People who don't get it don't know that they don't get it, okay? And I've got to get them to the point of being consciously incompetent. That's the next step. Okay, now you know what you don't know. If you can be honest with yourself and admit that, then in this continuing education plan, you say, okay, I'd love right out of dental school to go right to all on X cases, but that's probably not what I should do. I should probably start with, a good course on diagnosis and treatment planning. I should probably, learn some basics of the science before I can start doing the technique. I should probably take a course on communication because it's one thing to know how to do something, but you're not going to get the opportunity to do those things if you can't be an effective communicator, both as a leader of your team and a salesperson. Yeah, there, I said it. Okay, I said it. Salesperson. Okay, there are people that are watching this presentation who are thinking you're above that. No, you're not. Okay, every day you get up, if you put on clothes and take a shower and brush your teeth, you're selling something. And when you go to your office, you're selling your vision to your team. You're selling your ability to help your patients. But the most effective, the most successful dentists I know are great salespeople. So this continuing education plan, you need to know how to sell. You need to know how to close. Okay? Selling and closing are not 4-letter words. The other thing is choosing the right courses. There is an integrity problem in continuing education because everyone out there thinks that they're an expert or they want to be an expert. Everyone out there wants to be a teacher, okay? Regardless of whether they have the credibility to be a teacher or not, okay? A lot of the people, unfortunately, who are on the education circuit, they're there because they enjoy doing that, but they despise being a dentist. They haven't been successful at being a dentist. Okay? And now they're going to teach you how to be a better dentist. Okay? That doesn't make sense. So we've got to do our homework. Don't just listen to the claims. Just don't read the brochure. Don't just visit the website and just buy into everything. It may be 100% true. But if you can validate that with maybe someone that you trust, maybe a reference, someone that gives you that little extra boost of confidence that $5, $10, sometimes $20,000 or more that you're about to spend is money that's well invested. And again, don't forget the non-clinical continuing education. I remember this day, and by the way, I practiced 40 years. I had a very successful practice. I enjoyed most aspects of dentistry. Don't believe someone who says they enjoy everything. But I retired from clinical dentistry just last year, and I feel like I retired at the top. I kept learning until the end. It wasn't one of these, I started retirement 10 years early and then I stopped learning. No. Okay, you learn until the very last day. I hope that you can do what I believe I did, and that is I walked out at the top. I find that dentists love clinical topics, but the non-clinical topics also have value. I remember a meeting that I went to. It was one of these large professional organization meetings, and my topic was leadership there. And the room next door, the topic was, how to do a better porcelain veneer. And, they already started with the bigger room. How many people do you think showed up in my meeting? A handful. But there was standing room only on how to do better veneers. I'm here to tell you that if they had come to my course, they would have done a whole lot more porcelain veneers than if they went to that course. They can always find the clinical, but oftentimes it's the non-clinical that is just as important. Another one of my favorite mentors, I mentioned Dr. Peter Dawson, and the next one is Jim Rohn. And Jim Rohn had many famous sayings, but the one that speaks to this topic is he said, if you work on your job, you'll make a living. If you work on yourself, you'll make a fortune. So again, work on yourself. And that involves personal development, but it also involves team development to establish harmony and teamwork and trust and working relationships to improve both individual and group performance. So invest in your team. In your continuing education plan, you should have something for your team. When I teach a course on either a clinical or a non-clinical topic, I look at the doctors who brought their team with them and I say, congratulations, okay? Because you're going to get a whole lot more out of this by having your team members here with you. Yeah, you can go back and you can teach them what you learned, but it's not the same. It's them having the same teaching experience, the same learning experience that you had. So, penny wise, pound foolish comes to mind when doctors learn without involving their team. So you've got this plan, okay? You've got it in proper order. You're realizing you've got non-clinical as well as clinical topics. You are involving your team in this, and you are spacing out these stepping stones in your CE plan enough so that you can practice what you learned from the previous courses, and you build on these things. This plan does require some patience, but it will all be worth it. The reason it'll all be worth it is because you'll be able to provide better care, okay? But you can't give to others without receiving yourself. Now, the problem I also run into with doctors when they talk about continuing education is that it's like the best kept secret in their life. I don't know if they're just extra humble or they don't want to brag, or they don't think it matters. But you've got to let your marketplace know what you know. Okay? A lot of the competition in your marketplace, they'll take just the bare minimum. You know how they pick a course? I'll take whatever's free, okay, till I get to my 15 or 20 or 30 hours every year that is required of me by my state board. Okay? The really top leaders in the profession of dentistry take hundreds of hours of continuing education every year. But oftentimes their patients or prospective patients don't know that. Certainly choose to separate yourself by elevating your knowledge and your skills. But the gap in knowledge and skills needs to be made known to your marketplace through messaging. Why are we different? What can we do for you that other people probably can't? Because of what we know, how we've been trained. That needs to be made known in all of your marketing. That needs to be made known by your team to your patients.